I'm Dr. Eve. Welcome to the Sexual Health Centre. I'm sharing a number of stories with you that commonly come into my practice and, of course, into my inbox and my Facebook and my Twitter feed as well. I speak a lot about sexual medicine, sexual health, because I practice sexual medicine, and that means that I'm concerned around the chronic illnesses that many people unfortunately have today. And I say unfortunately because so many of them are preventable through modifying our lifestyle. Diabetes is becoming the number one disease amongst men and amongst women as well, diabetes type 2 specifically. And what that leads to is an erectile dysfunction. I have a mail from a man who says, please can you recommend that I see anyone about my erectile problem due to, I think, my type 2 diabetes. My immediate response to that is that of distress and almost anger that is not being managed properly from a healthcare perspective, because it is the obligation of the healthcare provider to ensure that the sexual health of you who has diabetes type 2 is managed as well. Sexual functioning is affected by 4 systems, namely your hormones, how your nerves work, how your psychology works, and how your vascular system works. A disease such as diabetes type 2 is going to be impacted by veins not working properly and by nerves not working properly. And of course, psychologically, you will feel depressed at some stage of it, or you could become depressed with diabetes type 2 if not well managed enough. So it's very important to go back to your healthcare provider and say to him, I'm feeling that my erections are beginning to become unreliable. It will begin to happen with time. And even if you are well controlled, even if you have good glycemic control, even if your lifestyle is well controlled, you may delay having erectile difficulties. But eventually, because of the vascular damage, neurological damage that's caused by the disease of diabetes, you may well find that you have erectile dysfunction, together, of course, with aging. So you want to go back to your healthcare provider and say, my erections are not what they used to be. Automatically, diabetes is going to be associated with erectile dysfunction, with cardiovascular disease, and with depression. And all of those diseases must be treated as a cluster. The good news for men is that there is treatment for your erections. You can start out with PD-5 inhibitors, which are Viagra, Cialis, Levitra. And if that doesn't work for you, which you may find that it doesn't, depending on the length of your diabetes and also how well managed it is, you then have an option to go to injection therapy. If that doesn't work for you, if you find that that's not really good for your lifestyle, you have the possibility of going onto an erectile vacuum device. And in the final stages, if that doesn't work, you have the possibility of a prosthesis. So there's always the ability to have an erection. For women, there is treatment for you as well. You definitely can replenish the moisture in your vagina because you'll find that you're dry. And also you can use vibrators to increase your desire to be sexual. There aren't any medication for women to feel more sexually aroused and have more desire if you have diabetes. But you certainly can work with the symptomology that you may have as a result of diabetes. Please talk to your healthcare provider about your sexual health if you have diabetes type 2. Thank you for watching this, and follow me on Facebook and find me on Twitter.